Prime Minister Narendra Modi holds video conference with chief ministers of all states. Most states request PM Modi to extend the nationwide lockdown. Government says it is considering the request. Active cases across India rise to 6,634 with 242 fatalities and 652 people discharged. Health Ministry says India's response to COVID-19 has been proactive. 586 COVID-19 dedicated hospitals and more than 1 lakh isolation beds set up across the country. Government under process of releasing the 12 million metric tons of food grain in 3 months under Pradhan Mantri Garib Kalyan Ann Yojana, considering the exigencies arising out of coronavirus situation. And WHO warns of possibility of deadly resurgence of the coronavirus if lockdown restrictions are lifted too quickly. Global death toll goes past 1 lakh with more than 17 lakh cases worldwide. Namaskar and welcome all of you in this edition of Doordarshan News. I am Kiran Jha and presenting the major stories of the day. Prime Minister Narendra Modi on Saturday interacted with chief ministers of all the states via video conferencing to strategize ahead for tackling COVID-19. This was the third such interaction of the Prime Minister with the chief ministers. The earlier and one-off had held on the 2nd of April and the 20th March 2020. During the interaction, several chief ministers made a request to extend the lockdown till 30th of April. Prime Minister observed that the combined effort of the centre and the states has definitely helped reduce the impact of COVID-19. But since the situation is rapidly evolving, constant vigilance is paramount. He emphasized the criticality of the coming of 3 to 4 weeks for determining the impact of the steps taken till now to contain the virus, adding that the teamwork is the key to facing the challenge. Prime Minister categorically assured that India has adequate supplies of essential medicines and said that measures are being taken to ensure availability of protective gear and critical equipment for all frontline workers. He also gave a stern message against the black marketing and hoarding, and condemning and expressing the distress at the instances of attacks on the doctors and medical staff and at incidents of misbehavior with the students from northeastern Kashmir. Prime Minister underlined that such cases need to be dealt with firmly. He also spoke about the need to curb lockdown violations and ensure that social distancing is followed. Talking about the exit plan from lockdown, Prime Minister said that there seems to be a consensus amongst the states on extension of lockdown by another 2 weeks. He underlined that the motto of the government earlier was Jaan hai Jahan hai. Now is the Jaan bhi Jahan bhi. Prime Minister also spoke about popularizing the Arogya Setu app to ensure downloads in greater numbers. Talking about the economic challenges, Prime Minister said that the crisis is an opportunity to become self-reliant and turn the nation into economic powerhouse. The Health Ministry on Saturday briefed the media on COVID-19 situation in the country. Joint Secretary in the Health Ministry, Love Agarwal, said India's response to COVID-19 has been proactive. He said that there are 586 COVID-19 dedicated hospitals and more than 1 lakh isolation beds in the country.
Dedicated COVID hospitals, जिनके द्वारा इन्फेक्शन ना फैले और पेशेंट्स को प्रॉपर ट्रीटमेंट मिल सके, उसको भी स्टेट के साथ मिलकर सेंट्रल गवर्नमेंट इंस्टीट्यूशंस के साथ मिलकर बनाया जा रहा है। और अब तक की अगर संख्या देखें तो 586 डेडिकेटेड हॉस्पिटल स्टेट ने हमें रिपोर्ट किए हैं, गवर्नमेंट ऑफ इंडिया और स्टेट गवर्नमेंट ने मिलाकर, जिसके द्वारा करीब 1 लाख प्लस बेड्स, आइसोलेशन बेड्स और करीब 11,500 जो उसमें आईसीयू बेड्स भी उन्होंने प्रिपेयर किए हैं।
And Joint Secretary in the Home Ministry, Punya Salila Srivastav, said that the centre has written to states and union territories to provide police security to doctors and other medical staff in hospitals and in the quarantine facility where they are working.
गृह मंत्रालय ने स्टेट्स और यूटीज को पत्र लिखकर फिर से आग्रह किया है कि डॉक्टर्स एवं मेडिकल स्टाफ को आवश्यकता अनुसार पुलिस सिक्योरिटी दे अस्पतालों में जब वे स्क्रीनिंग हेतु जाते हैं और जहां पेशेंट्स क्वारंटाइंड हैं.
And this is really a serious concern of government to take care of those medical staffs. Now, the central government has exempted the marine and fishing industry from the lockdown restrictions. And along with this, the government has also provided exemption to activities related to trading of fish. Although the centre has stressed that social distancing and cleanliness will be maintained while carrying out the trade in order to stop the spread of COVID-19. And moving on, central government under the Pradhan Mantri Garib Kalyan Anna Yojana is in the process of releasing the 12 million metric ton of the food grain during April to June. Finance Minister tweeted that government will provide for 80 crore people food grain, 5 kg per head per month at no cost. And free rations have been already reached to 2 crore beneficiaries. And the Jallikoti area in Meerut has been completely sealed after the several cases of coronavirus were reported from there. And there is heavy deployment of the police personnel in the area. People living in the hotspot areas are being provided essential items by the local administration. And also in some good news from the Meerut, a total of 9 patients were released today from the hospital, and these patients tested negative for coronavirus. The patient thanked doctors, nurses and the other medical staff of the hospital before leaving. Amid a growing tally of the COVID-19 cases in the country, people who have recovered from the diseases have expressed gratitude to doctors. And these corona survivors are urging people to stay at home for their own safety and society.
कुछ भी नहीं, बहुत अच्छा लग रहा है. यहाँ से खुश होकर जा रहे हैं हम घर हमारे परिवार के लिए. बस बिल्कुल अच्छा लग रहा है हमारा.
यहाँ पे हमारा बहुत अच्छा ख्याल रखा गया है पूरी डॉक्टर की टीम द्वारा, नर्सिंग स्टाफ, बाकी पूरे हेल्थ प्रोफेशनल्स द्वारा.
बहुत अच्छा लग रहा है. यहाँ के डॉक्टर ने बहुत सेवा करी है, हमारी बहुत ध्यान रखा है और हमने इस बीमारी से जंग जीती है. आप अपने घरों में रहिए, अपना ख्याल रखिए और सब सुरक्षित रहिए अपने घरों में.
And stay home and be safe. This is only the Mool mantra to get safe from coronavirus. And due to lockdown across the country, a Hyderabad-based NGO, Nipuna, has made arrangements to feed migrant workers in the city. More in this report.
During the countrywide lockdown due to coronavirus, there are thousands of daily laborers who are on the brink of catastrophe due to lack of work and food. In order to rescue them from hunger, Nipuna, a Hyderabad-based NGO, has made elaborate arrangements for feeding the poor migrant laborers who have come in search of livelihood. Nipuna Human Development Society has been immersed deeply for the past few weeks in making food arrangements to the migrant laborers. According to the founder of Nipuna, Subhadra, every day 1500 laborers are being fed. Really thanks to the dedication and determination of Nipuna NGO for its magnanimous activity.
We hired a kitchen. It's a Pakka Nellore kitchen. She is Anusha, owner of this kitchen, and my team is Mr. Karthik, Mr. Hemant Vallabneni, Mr. Harsha Reddy and Mr. Khadar Basha. We 5 are our team, and we are working to find the needy every day, and we are cooking 1500 meals per day, and we are giving to the needy people. And this is what we are doing, and we want to do more, and we don't know when the lockdown ends, and we don't know anything. Whatever our capability within our limits, we want to do more and more to the needy people, to the nation.
Dr. K. Sudhakar Rao, Bureau Report, Doordarshan, Hyderabad.
Amid the ongoing lockdown across the country, Municipal Corporation in Mumbai is maintaining the responsibility of keeping the city clean. The sanitation workers are getting full support of the local people, and these workers are also want people to stay in their homes so that the corona can be controlled. Local applauded their efforts to battle coronavirus.
मैं सफाई कामगार हूँ, बीएमसी कर्मचारी हूँ। हमारा काम है मुंबई का साफ़ सफाई करना, जो कि हम लोग जो कचरा उठाते हैं, जो रास्ते में जो झाड़ू मारते हैं, उससे रोगराई फैलना नहीं चाहिए। उसकी वजह से आपको विनती है, सब जनता को विनती है कि आप घर के बाहर ना निकले।
मैं मुंबई का मुलुंड का रहवासी हूँ। जो भी है अपना देश में, जो मुंबई हो, दिल्ली हो, बेंगलोर हो, ये जो बड़ा बड़ा सिटी में है, सफाई कामगार है, पुलिस है, आरोग्य सेवा है, उनको कोरोना के खिलाफ जो काम कर रहे हैं वो हराने के लिए बहुत अच्छा काम कर रहे हैं, उनको धन्यवाद मानना चाहिए।
So this is the responsibility of each and every citizen, that they are coming forward and making aware each and every citizen to get rid of this and get safe from the coronavirus. The rising cases of COVID-19 in Dharavi is a matter of concern, and the police personnel on the duty in these areas are at the risk. For complete sanitization of the police personnel, a sanitization tent has been put up outside the Dharavi police station for the policemen, those who are on the lockdown enforcement duty. And this has been set up by the local MP Rahul Shivale. Our correspondent Shama gets this report. Let's have a look.
Dharavi is Asia's largest slum, and the rising cases of positive COVID-19 cases has become a headache for all. The one category which is under tremendous pressure of infection is the police personnel ensuring the lockdown in the area. But for making them stress-free, the Dharavi police station has erected a sanitization tent wherein the police personnel who are going on duty or in between or when they are about to leave for their homes can go inside and get sanitized or get disinfected, thus making the chances of infection towards zero. Shama Mishra, DD News.
Under exercise NCC Yogdan, around 2,000 NCC volunteer cadets have joined the fight against coronavirus since 1st of April. And these cadets are helping the civil administration, defense and the police personnel in 12 states and union territories. And requests have come in from the states to requisition NCC cadets for the various tasks. Around 50,000 cadets have so far volunteered to contribute in exercise NCC Yogdan. The state machinery is ensuring that all the cadets are provided with the proper safety equipment like the masks, gloves and the other precautionary measures during their deployment. They are also not being employed in the area which are sealed or earmarked as the hotspot by the respective state governments. And moving on, researchers at the National Institute of Pharmaceutical Education and Research, Guwahati, have come out with the two products that promise to be a great help in the fight against COVID-19. The first product is a 3D printed hands-free object that could be used to help open or close doors, windows, drawers and refrigerator, handle or press elevator buttons and laptop, desktop, keyboards, including turning the switch buttons on and off. The researchers come up with the design for the fabrication of the 3D printed object after a detailed analysis of the several resources for risk measurement and now how viruses are spread through bare hands. In a step to contribute their part for nation's fight against COVID-19, Panchayat Murtiyan of the Kathua district has passed a resolution to skip one-time meal so that it can be distributed among needy people during lockdown. In Panchayat of around 2,500 people, pregnant women, children, elderly and the sick are exempted from this resolution. And moving on, the IITs have always been on the forefront when it comes to technological innovation. IIT Guwahati, which has already earned a pride of place for its innovations in not to be left behind. The institute has come up with several innovative ideas and products to fight the coronavirus crisis. Let's have a look.
In response to the COVID-19 pandemic, IIT Guwahati has contributed around 35 project ideas, of which the departments of Mechanical Engineering and Electronics and Electrical Engineering are making efforts to develop several state-of-the-art technologies, which include a robot-based drug and food carrying unit.
The main problem which they are facing is that in isolation ward, where a patient is there, it is highly risky for the medical team to go inside and have direct interaction with the patient. So, if some devices are there by which this direct interaction can be avoided, we thought, okay, we can develop a robotic vehicle so that people need not have to go inside the isolation ward. So, from outside we can control. At present, even day before yesterday only we have seen this video. They said they will be needing more, even in not only in Assam as well as in Northeast also this will be required.
IIT Guwahati has developed 2 robots that can be deployed in isolation wards for corona patients for delivery of food and medicine and the collection of contagious waste.
Actually, we are also planning for giving a temperature sensor that means that can read up to 1 or 2 meter range the patient's temperature. With that, the doctors can monitor remotely how his health is going on. And also we are going to place a IR sensor and below, so that if someone comes in front of this robot, then it will stop and it will just ring the horn.
The team from IIT Guwahati's Mechanical Engineering and Electrical Engineering departments believes that the move will reduce human involvement in isolation wards that can contribute to safety of health workers. With camera person Onup, Mridushmita, DD News, Guwahati.
The government's official fact-checking entity has debunked media reports which claimed that the Ministry of Railways has issued protocols regarding passengers' travel post-lockdown period. The PIB fact-check team tweeted that such claims are speculative and misleading. No such protocols have been issued by the government. And the PIB has also dismissed media reports of shortage of hydroxychloroquine for Mumbai doctors dealing with the COVID-19. PIB fact-check team termed the report as fake. With the rising number of coronavirus cases in the country, the forces have come together to fight this invisible enemy. In addition to CRPF and police, the Indian Air Force is working shoulder to shoulder to supply essential goods to every citizen. In this fight, the Air Force C-17, C-130, IL-76, AN-32 and Dornier aircraft today dropped essential loads in Mumbai, Bangalore and Guwahati and Leh. Along with this, it also shifted army doctors from Lucknow to Guwahati. The Air Force is continuously working around the clock to ensure that the items such as the medical supplies and equipment, disinfectants and the medical samples reached to their desired destination to assist other professionals to fight against coronavirus. And moving on, in view of the ongoing pandemic of COVID-19, the Regional Outreach Bureau of Ministry of Information and Broadcasting has initiated a field-based outreach and awareness program through travelling audio announcement system in the rural areas of Maharashtra. And under this program, the three-wheeler are installed with the pre-recorded audio announcements and messaging to create the awareness about the coronavirus issues. 20 vehicles have been deployed in different COVID-19 affected districts, which travel from 8 to 10 hours per day, covering a distance of about 50 kilometers. In order to make messaging more effective, the staff artists have created audio messages and songs in local languages. The audio messages shared through public announcement will focus on taking the various precautionary measures to contain the spread of infections, such as maintaining the personal hygiene, and will also provide list of essential services allowed under lockdown. Now, moving on to new development, the News Broadcasting Standards Authority of India (NBSA) issued advisory to the news reporters and agencies in respect of the interview of persons kept in isolation due to COVID-19 pandemic in the country. The independent educating body of the news broadcasters advised all the reporting units of COVID-19 not to enter hospitals or isolation wards where the COVID-19 positive cases are kept in isolation to contain the transnational contagion. It also advises not to interview the medical personnel so as not to jeopardize the other lives in the country. The WHO has warned countries to be cautious about lifting restrictions introduced to curb the spread of coronavirus. Director General Tedros Adhanom Ghebreyesus said that the WHO would like to see an easing, but at the same time, lifting restrictions could lead to a deadly resurgence. He said that there has been a positive side of the slowing of epidemics in some European countries, including Italy, Germany, Spain, and France. However, he mentioned that there had been an alarming acceleration in other countries, including community transmission in 16 countries of Africa.
Some countries are already planning the transition out of stay-at-home restrictions. WHO wants to see restrictions lifted as much as anyone. At the same time, lifting restrictions too quickly could lead to a deadly resurgence. The way down can be as dangerous as the way up if not managed properly.
And also in other international development, Istanbul, Ankara and other major Turkish cities locked down for 2 days to combat the spread of coronavirus under an Interior Ministry order. As the country's death toll from the pandemic rose to 1,000 above on the Saturday. The restrictions were imposed in 31 provinces across the country and scaled up existing curbs under which people under the age of 20 and over 65 have been told to stay at home. Turkey also halted all international flights, restricted domestic travel, closed schools, bars and cafes and suspended mass prayers. But people have still been going to work to sustain economic activity. Confirmed cases of COVID-19 increased by 4,747 and 98 people died in the last 24 hours, bringing the death toll to 1,006. The Wuhan city worst hit by the COVID-19 in central China's Hubei province is implementing strict control measures on its public transport system as the city lifted its outbound travel restrictions on April 8, ending a 76-day lockdown. At present, 2 major ferry lines have reopened. The city has a total of 8 ferry lines, and passengers need to provide their health codes and have their body temperatures taken at the entrance of the berth. They are reminded to keep social distancing when they buy ticket, and every passenger needs to scan QR codes twice before boarding. Besides the ferry service, other means of public transportation like buses and subway are also implementing strict prevention and the control measures like scanning codes and frequent disinfection of the public facilities and the public areas. And that was all in this edition of Doordarshan News. But keep watching the edition also. But stay safe and get rid of the coronavirus and save your society and yourself. Namaskar.